Hello, I'm Dr. Tim Allison, Director of Public Health for NHS Highland, and I'm talking to you today about the introduction of vaccination against COVID-19 across NHS Highland. We've been planning for many weeks, along with Scottish Government, to arrange for the start of vaccination, and I'm pleased to say that this week vaccination has started. There are two vaccines that are included within our plans. One is the Pfizer-BioNTech vaccine, which requires freezing at around -70 centigrade, and the other vaccine is the Oxford AstraZeneca vaccine. We're starting to vaccinate with the Pfizer vaccine because that's received regulatory approval, but we are looking, once approval has been granted for the Oxford vaccine, to move on to that. It's important that we recognise that the vaccination programme is a marathon and not a sprint. It will take many months to complete, and we're only at the start of that. Precise details for the programme will depend on various factors. Immediately, the regulatory approval of the Oxford AstraZeneca vaccine, but it'll also depend on how quickly we are able to get vaccine deliveries and other logistical considerations. We're starting vaccination with a small number of NHS staff, particularly at risk of being exposed to COVID-19. And then we're moving on to care home staff and care home residents, as well as some further NHS staff. When we move on to the wider population, we'll be starting with the most vulnerable in the older age groups, and then going down to other parts of the population. And across the whole of NHS Highland, we aim to concentrate on using general practice as the vehicle for vaccination, which both fits in with the geography and the dispersed communities across the Highlands and the Islands and Argyll and Bute, and also builds on the success that we've had with the influenza immunisation programme. It's important to emphasise that while COVID vaccination is extremely good news, that it's only part of the programme to control COVID, and we need to keep following the guidance and the regulations. We need to keep social distance, we need to follow the tier rules, we need to keep in line with the facts guidelines, and then if we do that all together, and once we're called for vaccination, if we take up that vaccination, that will be the best way that together we can tackle COVID, and we hope remove COVID from NHS Highland. Thank you.